The emerging Omicron virus has resulted in travel bans and new lockdowns overseas, and will almost certainly begin to appear here in Oklahoma if it isn't here already. With more on what doctors know right now and what precautions are being taken, we're joined by reporter Jason Doyle. Jason?
Anecdotally, South African doctors are saying the disease doesn't seem as severe, but it is easier to spread. Officials caution, we just don't have enough information yet.
Just when we thought it was safe to go back in the water, here we are with an Omicron variant.
Some of the concern about the COVID-19 Omicron variant is centered on transmissibility. In just a week, the number of COVID cases in South Africa, one of the first countries to detect the variant, have tripled.
However, we have to remember that the vaccination rate in South Africa is 35%. So still information, we're not sure if that's really a truly increased transmissibility or if it's a slight increase in transmissibility on top of the relatively low vaccination rate as a confounding factor.
On Thursday, President Biden announced travel restrictions which require international visitors to test 24 hours within departure. Earlier this week, Biden banned travel from several southern African countries to the U.S. But some think it's too little, too late.
I honestly very much believe that shutting borders down probably is too late at this point. It's like closing the barn door after the horses have already left.
The Oklahoma State Health Department has begun looking for the Omicron variant in our state.
Our public health lab has worked tremendously hard and very, very proficient in making sure that we have the capacity to be able to identify not only the Delta variant, but potentially the Omicron variant or potentially any other variant that may potentially occur here in the United States or in Oklahoma.
The key to catching this variant is for people to get tested for COVID using a PCR test.
OSDH does encourage anybody that has symptoms of COVID to go get tested.
Because the discovery of the Omicron variant is so new, there is not enough data to know how this version of COVID will impact our population.
Anytime you see the virus spreading a lot and a lot of people getting infected, you increase the likelihood of mutation.
The mutations on the Omicron are important because there's at least 30 mutations for this new variant, which is quite high in number.
Viruses mutate because they don't have the mechanism to duplicate their DNA or RNA.
So when they get inside of our cells, mammalian cells, they use our mechanism to duplicate their DNA or RNA, and then they use our machinery to make proteins.
While the viruses use our mechanisms to make proteins, they do not use them to eliminate mutations.
So the viruses are replicating their own genetic code, either RNA or DNA, very sloppily. And these mutations are happening. And then the mutations will lead to different amino acids in a protein.
Many mutations actually lead to dead ends for the virus, but occasionally the mutations will give the virus an evolutionary advantage for survival.
And just like we saw in Delta, its mutations made it more infectious, and so therefore it had a survival advantage over the original variant, and now almost all infections here and most of the world are Delta.
And we just simply do not know whether the Omicron variant will, displace the Delta variant. We just don't know at this point. So it's too early to predict what may happen.
There is some concern that Omicron could be resistant to current COVID vaccines.
The vaccines that we have in the United States, we're still thinking that it's probably going to be okay, yet again, we don't have a lot of information yet.
Most of the companies that make the vaccines now are doing tests with the genetic strain that's causing this particular outbreak, but we don't know.
The variant also is being tested against proven medical treatments like monoclonal antibodies.
If the virus itself, a new variant, is different enough to trick the monoclonal antibody that we've used prior, then that's not going to work. We can use the infusion, but if it's not close enough to the new spike proteins, we may have a problem.
I think the treatments are going to end up being very, very important for reducing the burden of this particular disease.
However, Oklahoma's medical experts say it's not time to panic Just be vigilant.
I don't think we have to be gloom and doom yet. I think we live in a world where we can be cautiously optimistic if we can make sure that we do the things that are going to help keep the rest of us safe.
Coming up later in this newscast, Susan Cadeau will moderate an in-depth discussion on the pandemic's impact on minority communities and how Project Trinity is providing some valuable information to help address it. Rich?
Jason, thank you. Well, did the Thanksgiving holiday result in a spike in COVID infections? The rolling 7-day average of new cases has increased significantly, up from 679 to 1,036. Hospitalizations have risen to 552. More ICU beds are in use, 171. And we are just one death shy of the grim total of 12,000 Oklahomans lost to the virus. Also, as of Tuesday, 55% of our eligible population has been fully vaccinated, and the number of people receiving booster shots jumped by almost 10% this week to a total of just over 376,000.